I'm Dr. Charles Bauer. I'm one of the interventional radiologists at Goshen Hospital. A lot of people develop a disease called benign prostatic hypertrophy, or BPH. As guys get older, the prostate gland can enlarge and can press on the urethra, which is the tube that carries urine out of the urinary bladder. As it enlarges, it can make it hard to go to the bathroom. People will complain about difficulty getting started urinating, weak stream urinating, feeling like their bladder doesn't empty completely, and having to go to the bathroom all the time, including having to get up during the night to go to the bathroom. Benign prostatic hypertrophy, or BPH, can be treated in multiple ways. Usually the first line of treatment is medical therapy, and there are different medicines that can be used that can often improve these symptoms. If medical treatment doesn't work, then you start getting into more invasive treatments. And one of the options is that the urologists can basically do a surgical treatment where they put a scope actually in through the urethra and surgically scrape out some of the inside of the prostate to enlarge the opening so that the urine can get out more easily. That's a little bit more invasive procedure. A newer IR procedure that we can offer is to basically cause the prostate to shrink by partially cutting off its blood supply. And so to do that, typically what we do is we put a thin plastic catheter in through the left wrist, generally under a local anesthesia with a little bit of sedation. We can put the catheter into the vessels that supply the prostate and put some small particles in there that cut off blood flow to the prostate and make it shrink. Most patients are able to return to their regular activities within 1 to 2 days after the procedure. There are several different ways that patients come to us for this procedure. Sometimes patients will be referred either by their primary care physician or by a urologist that they've seen. Other times the patient may come to us seeking more information about this treatment option. So typically a good candidate for prostate artery embolization is a patient with BPH who has failed medical therapy and continues to have symptoms. Particularly patients who may not be the best surgical candidate because of underlying comorbidities may benefit from prostate artery embolization. We'd be happy to see the patient in the clinic to evaluate whether they're the appropriate candidate for it. The other thing that can be helpful is to have a co-requisite urology consultation as well, so the patient can fully understand their options and that they can be evaluated by both urology and interventional radiology to determine what the best treatment option is.